Hello and welcome to the October 21st, 2020 edition of the Carlisle Community Forum. I'm Doug Stevenson, former selectman here in Carlisle, and I'll be your host for today's program. First of all, I'd like to extend a welcome to all of our viewers and all of the Carlisle residents, and extend our greetings and well wishes to everybody in our community. 2020 continues to be a challenging year for all of us, and we sincerely hope that everybody is well and staying healthy and finding some opportunity for normalcy in these very trying times. And we're hoping today's show will be uplifting and informative for all of Carlisle seniors and all interested residents. So welcome everyone. I'd like to introduce our panelists and participants who are here with us today. First of all, our Council on Aging Director, Joan Ingersoll, our Council on Aging Outreach and Program Manager, Angela Smith. Representing the Friends of the Carlisle Council on Aging is Nancy Showett West, our Board of Health Agent, Linda Fantasia, and today's featured guest, David Tasto, the owner of Assisting Hands Boston Northwest. So welcome to all of you, and thank you for participating in today's program. We really appreciate you being here. At this point, I'd like to turn things over to Joan Ingersoll, our Council on Aging Director, for her welcome.
Hello and welcome to the program. I just have a few quick notes that I want to share with people. As you know, it's fuel assistance season, winter heating season, and I want to make sure everyone's aware that the COA can help you with fuel assistance. We have a few different resources that we can use, and if you want to know more about whether you qualify, feel free to give us a call. We also have a brochure on our website now about food, fuel, and financial assistance for Carlisle residents, and I encourage you to look at that and see if there are things that you may qualify for. Given the difficult circumstances we've been in over the past 6 months, we're finding that people are needing assistance maybe for the first time, and we are happy to help you access anything that might be available to you or your family. So with that, I would like to turn things over to Linda Fantasia to give us an update from the Board of Health.
Thank you, Joan. And on behalf of the Board of Health, I'm happy to be here to give a quick update on COVID in Carlisle. Carlisle is doing very well. We have had a total of 25 confirmed, that means lab test positive cases of COVID, and that's since the very beginning back in March. Carlisle is considered a low-risk community, but we do realize that people don't just stay in Carlisle. People go to nearby towns to shop, for various things. And so what it comes down to is personal responsibility to keep yourself safe, you and your family. That means social distancing, wearing masks, hand washing. And this year in particular, it's important to get that flu shot. We did have a senior flu clinic, which was very successful, and we thank all the volunteers who made that work. And I know it can be difficult. Seniors, it's recommended to get the high-dose flu vaccine. Pharmacies do have it, but they run out quickly. If you get an opportunity to get the high dose at a pharmacy, please go ahead and do it. Don't wait, or with your primary care. We've had no cases of COVID in the school, students or staff, and the Board of Health has formed we call it the COVID Task Force. And what the task force is doing currently is coming up with recommendations for the holidays. The holidays, we know people want to be with family, they want to be with friends. We're going to have college students returning home. And we think a lot of this can be done and done safely without increasing our numbers of COVID. So this committee will be coming up with recommendations. They will be posted on the town website under the Board of Health. We'll make it available to the COA so they can put it in their newsletter. And then in December, Dr. Jean Barry, who has a practice in Concord, Jean is going to do, she's on the task force and she's also on the Board of Health. She is going to do a longer presentation where she will go over not only numbers, but symptoms, tests, test results, what they mean, and answer a lot more questions. We would really like for you to send in some questions for Jean. And you could do that by just emailing the COA or the Board of Health or giving us a call. So if there's something that you have a question about, you haven't been able to find an answer on the state website or our website, please just give us a call. So I think that's pretty much all that I have to say. Carlisle, again, is doing well, and we very much appreciate that people are taking this, continue to take this seriously. We don't want people to get complacent. It could be that we see an increase in numbers in the fall, but that's kind of expected. I wouldn't worry about that too much. Just continue to do what you need to do to keep yourself and your family safe. Thank you.
Linda, one quick question. How are our surrounding towns doing?
So the state website, which I feel is very helpful, and there's a link on our website that takes you right there. They have a color-coded map. Now, Chelmsford, and the color code is gray, yellow, green, red. They have the order right. Carlisle is gray. That means we are doing very, very well compared to surrounding communities. A lot of the other communities are in the yellow. Chelmsford just went to red. That means they're at a high risk. So their numbers have increased. So if you do want a quick look at what surrounding towns are doing, which may dictate where you go to shop, food shop or other errands, it's a good idea to check that map. It's updated every week by the state, and it's a very helpful way to know what's going on in nearby towns.
Thank you very much.
Sure. And I'm sorry I can't stay for your full meeting, but thank you again for this opportunity.
Thank
Linda,
you.
thank you very much for joining us today, and thank you very much to you and to all the members of the Board of Health for your hard work. I think the Board of Health and your team have gone into overdrive and have been tested like no time before in terms of our response to this pandemic. So we appreciate it, and it's great to hear that both through your good work and through the diligence of the people in Carlisle, we're for the most part staying very healthy and doing well and slowing, if not stopping, the spread of COVID. So thank you very much.
I will pass that on to the board. Thank you.
Great. Now we're going to move on to spend some time with our featured speaker today, and that is Dave Tasto, the owner of Assisting Hands, a home care operation located here in Boston Northwest. Dave is a transplant from Minnesota. Came out to our part of the country a number of years ago to go to school, and has spent many years here in a variety of careers, including engineering and security equipment and consumer products. And a few years back, due to some personal matters in his family, he took a great deal of interest in home assistance and family care issues. And as somebody once said, he liked it so much he bought the company. So Dave purchased an Assisting Hands or started an Assisting Hands franchise a couple of years ago, and since that time has done a lot to assist seniors and people in need of assistance in their homes in both our community and communities around us. So Dave currently lives in Wilmington, not too far away, with his wife and 2 young children. And from what he has told me, his business continues to thrive, and he and his family continue to stay healthy during these difficult times. But we look forward to hearing from him today about his recently published book called Thriving at Home, and as well as many tips that he has for our seniors as well as for families of seniors in terms of taking care of themselves in their homes. So with that, I'll let Dave talk a little bit about his book, and maybe begin by telling us, how he decided to write it and what was the inspiration.
Thank you very much, Doug, and to the rest of the group here today. I appreciate the opportunity. I'm excited to be helping folks in the community, as Doug said, and I'm very passionate about what I'm doing and have the opportunity to help folks. So thank you. So I'm very happy to have launched a book this fall that is intended to help family caregivers support the loved ones at home that we're seeing typically these days, particularly with the pandemic around us. But I wanted to write this book for a few different reasons. First, many of us have a personal goal to age in place, which basically is live your retirement years where you want to, and that can be at home. On our own, we can move in with family members or into an independent living community or assisted living community. In home care, I've seen firsthand, though, how individuals can live happy aging in place. Maintaining and managing your health at home is key for staying out of the hospital. So basically, the book is Thriving at Home, and it's a handbook for preventing hospital stays. So a key piece of aging in place at home is to keep you and your loved ones out of the hospital. Hospital stays can be very difficult. They're emotionally, physically exhausting. They can have unintended consequences, though, as well. There can be complications, certain infections, and even now the risk of COVID increases. I've also seen firsthand, that family caregivers are providing a lot of the support for loved ones at home these days. Most of them don't, though, have formal training. And they're juggling work, households, as I am. I have younger kids, as Doug mentioned, or are in the sandwich generation where they're caring for children, but also their parents as well at the same time. So at Assisting Hands, I've seen that our team does a lot to support folks, live happier and healthier at home. And a lot of the interventions or tasks or efforts that we perform at home can be and is being done now by folks at home, family caregivers providing care for their loved ones. I decided to write the book to share a lot of the knowledge that we have with those family caregivers, with extra tools and interventions. Our loved ones are going to have likely better health outcomes and much more happiness. So I wanted to promote awareness about the care options, including the type of support available at home.
Dave, maybe you could, let's dive into some specifics and tell us some of the information that you've included in your book specific to helping families avoid the trips to the hospital and other catastrophic events.
Sure. No, thank you. Let me just share something here quickly. So, a big piece of staying healthy at home is to avoid, as I mentioned, the trips to the hospitals. A big piece in avoiding a trip to the hospital is to avoid trips or falls at home, as the number one driver for hospital admissions is, and are those falls. So keeping your home safe is critical. Particularly home safety is what is referred to as, and that includes keeping your floors clear of hazards. Having sufficient lighting to be able to see the hazards is critical, but also to see hazards, you need to make sure that our eyes are checked regularly. As we age, our eyes do tend to degrade, and so making sure that we're able to see hazards at home is so critical. A few other things, just briefly, about some of the home safety things that are critical at home. You can install grab bars in various locations, particularly in the bathroom where things can be slippery, or you have to get up and down from to go to the bathroom. Basic stuff about keeping floors clear. Also, we want to discuss not letting slip hazards exist on the floor. So having towels or wipes around to clear up spills right away after after a spill, so that they aren't providing a slippery surface for a fall. But the other piece is about staying home and managing your health, is to first know which symptoms are normal for your condition. Once you understand which symptoms are normal for your condition, you can understand and realize that, hey, you're traveling out of something normal and you're running into an abnormal situation. That can help you understand when you might need to escalate to a healthcare provider, reach out to your primary care physician, as early intervention is critical and helps in de-escalating issues so that you don't turn into a requirement to go to the hospital. Just a quick note, though, I want to be clear that going to the hospital is a very important piece of our healthcare system, and the care that you can get at a hospital is often the best care that's available. So I do not want to, disparage hospitals at all. Although I just want to highlight that there's things that we can do at home to prevent that trip, as the trips can be challenging for us. Transitioning home from the hospital is also a very critical period, and it can be overwhelming. So included in the book is a detailed checklist about things to ask, things to be aware of when you're going to be discharging. They can be, what kind of medications are you going to be on? When do I need to pick up the medications? Where they're going to be at? What is the schedule of medications I'll need to take? A follow-up appointment with the primary care. When is that? What do I have the ability to get to the appointment? Transportation needs. Some of these things that we have to just make sure that are in place so that the transition back home from the hospital or from a rehab, which is a similar transition out of a hospital, is to go to a rehab, and then from the rehab to home. If you need extra support at home to keep your loved one healthy and happy, there's a guide inside the book with questions to ask your primary care even. So when you go to a follow-up appointment with your primary care, you typically don't have a lot of time. It's very critical to go to that appointment prepared with a list of questions, a notebook to capture any follow-ups or any information that you're going to need. You can discuss all those common situations or common symptoms, for your situation, and discuss anything that might be abnormal as well. So when to find extra help, there's also a section in the book, if you do need extra help at home, where to look, questions to ask, and so forth.
Great. Thank you very much, Dave. We really appreciate that overview. Yep. And I know I've got a number of questions. I'm sure our other panelists have a number of questions for you about both specifically the services that you provide and also strategies in supporting the seniors in our community. I know Angela has her, and Jonah, I'm sure as well, have their fingers on the pulse of the needs of Carlisle seniors, and I think many of the things you have to offer address so many of those concerns. For me, I'm actually, I guess I'm not quite in the sandwich generation, but I am in the, for me, this is very personal because I have some aging parents at home, and it was interesting how you put it. You said that that people have a plan to stay at home, but I think it's it's almost inertia. There's an intrinsic stubbornness that in at least that I've experienced of people desiring to stay in their homes. So, and I know for me personally, anyway, I'd like to support my parents in their efforts to stay at home. So this is a great conversation for me and hopefully for many others. One of the sort of general questions that I have is, do you have strategies and thoughts on how you approach families and specifically the seniors to have these conversations about possible changes in their home life and in order to make their home a safer place to stay. Because I think that's the first big step that a lot of people probably find a hard time getting past.
Great question, Doug. We get this actually a lot. How do you break that chasm and to have that conversation about, hey, something else needs to happen? What do we need to do to be able to live at home and stay healthy? The program manager in me, basically has it coming from what are the objectives that we want? And I think having your conversations with loved ones, family members, pulling in the extended family or folks that are kind of keen on what is going to happen with mom, dad, or whoever it might be. Identifying with that group of folks, what are the outcomes, and having the person that you're discussing or talking about, their objectives, kind of documented so that people can truly hear what the aging in place objective really means. It might mean a lot of different things for different folks. As I mentioned, where home is could be, different for many different people. At home for me, maybe be my residence with my family, or it might be to move to a community for someone else. So understanding those objectives, without getting into the full kind of aging in place picture, there's a lot of other financial, legal, and I like to call them aspirational objectives, for your retirement years. Like, what is it going to take? Are you going to want to take that trip to go see family, in another state every year? With that will come transportation needs. It'll come financial kind of questions as well, but you kind of have to look at it from a full set of objectives and outcomes for that aging in place. And then you can start listing what kind of areas you're going to have to investigate and what things you can do on your own and where you'll need help. And folks watching the show today are already in good hands with the Council on Aging here, but yeah.
Great, thank you. I did read, and thank you for the copy of your book, and I did read through it. And I think one of the things that I was looking for that I know you do touch on, but maybe you could touch on additionally here now is the strategy for making the home safe. And you have a sort of a checklist that people could take and walk through with their senior relatives, and just walk through the house with this objective checklist and say, we're taking care of these 10 very specific items.
Yeah, and it has a little graphic about a home as well, and each of the rooms in the home. One thing I like to mention in the kitchen, I talked about, keeping the floor clear, having towels to drop down and make sure they clear up spills. Another thing that I would suggest in the kitchen is to have commonly used items placed in very easy to get or easy to reach locations. If you're reaching for bowls or plates or mugs for coffee, they don't have to be up in the cupboard, a little bit higher above your head. They can be upside down on a shelf right on the countertop, so that you're not stressing or reaching too far to get at the commonly used items. In other areas in the house, making sure that the stairs have railings, not just on one side, but even on both sides. As we age, we might have a situation where, our right leg is stronger or our right arm is stronger, or we've had an injury on our left arm. And so when you're going up or you're going down, you might need assistance or, like something to support you on either side of the stairwell. I talked a lot about the showers in the bath area. That is very high in terms of a risk area for falls or slips because of particularly the wet environment with coming in or out of the shower or bath. But the floors are usually, need to have some kind of a covering or rug, but that is not slippery, so that we're avoiding or doing everything we can to prevent the falls. Get help, if that family member is at a critical time to have help is when you're showering. I know there's ways to protect privacy, but have someone assist in or out of a shower or while moving around in the bathroom, just to make sure that we're doing everything we can to prevent a fall. And just general cleanliness around the home, not having cords or anything in the walkways or hallways. Please, if you can, get rid of every throw rug in your home. Okay, they are notorious. Not so much that they are slippery, but they also have edges that curl up and can be a concern. Transitions from one room to a next is another, if the height changes, it just can be another cause for a trip or a fall. So there's a number of places. We typically will come out when we start up with clients and do a full home safety assessment, kind of going through everything, not just focused on falls, but making sure that fire extinguishers, fire alarms, and everything else are in place as well. Home safety is very critical.
I'm glad to hear it, because that was going to be one of my questions, whether or not you provide that service, go out and do basically the home safety audit and provide feedback. Because I'm sure seniors will be much more willing to take that input from an objective professional as opposed to necessarily family members and other relatives. So that's great to hear. I don't want to consume all the question time. I'm sure Joan and Angela and maybe Nancy have some questions, so I'll certainly open it up if any of them would like to get a question in here. Angela, you're on mute.
Dave, what do you think is the hardest thing to get seniors to even consider getting care?
The hardest thing to get seniors. So first of all, many folks are, the folks that want to stay and live at home are often independent, right? So they're the folks that you're probably hearing a lot of the questions from Angela or Joan, or they're the ones asking the question about how do we stay at home. But I just spoke to someone yesterday who, isn't ready to get help, right? But his wife might need a break, right? He probably run into these kind of questions a lot. Often asking if there's certain things that person who might need some support, or the person caring for them to get a break, right? In the case yesterday, it was just to get out and see a friend of hers, right? She's caring for her husband. In this case, it was just a break, a few hours to get out and see a friend of hers. And her loved one, her husband, is fully supportive of this. So it's not as if he doesn't want this to happen, but the help would be to come in and just be around in case there's something needed in the home, right? So just we call it like more of a respite time or a respite break. We want to do everything we can to support that independence. So our approach at Assisting Hands is not to come in and do everything from start to finish, right? Basically taking care of everything that is needed. If a meal has to be prepared and our client is able to help cut up some vegetables or whatever it might be in the home to prepare for that meal, that's what they're going to get to do. Or in the other case where, we might be helping in the bathroom, if they're still able to wash their hair, we're going to have them washing their hair, right? So we're not going to do all the stuff for them. But to get help, and back to your question, it's really about coming up with a task or an activity that is key to kind of supporting that goal to age in place. If they want to stay where they are and they need certain things done, how do we come up with that task on how to do this? In the case of yesterday, there's the person wants to get out and golf, right? These days, it's a little bit tough to get out. Some of the weather's getting cooler, but there could be some indoor driving ranges that we can get out, and our aides can, provide transportation to and from the driving range so that they're still able to continue doing, hitting the golf club so that they're ready for the spring again, or whatever it might be. But coming up with a task is a big deal. Outlining those things and aligning on the objective together with the care partner and, our client.
Thank you.
Joan or Nancy, do you have questions for Dave?
Well, I do. I was wondering how the pandemic has changed the way you do business, and have you found people even more reluctant to have people they don't know be in their homes? And, have you had to do a certain testing protocol, or how have you responded to the situation that we face right now?
Thank you, Joan. Great question. Yes, there have been a lot of changes that we've had to put in place. But to get back to your question, how it's changed our business. Initially, we did have some clients in the spring who only had some small shifts and only had a little bit of help during the week, did have family take over. And that, to get back to the point in writing this book, was something that kind of said, what, these folks could use a little bit extra help. Our professional caregivers do have a lot of training and skills that they can, use in the home. And now when some of our clients dialed back and decided, put their care from us on pause, family caregivers had to shoulder that burden. As it turns out, we were able, getting some calls, in like June timeframe, July timeframe, saying, they're throwing in the white towel and say, I could use a little extra help now, after 3 or 4 months of, helping and doing everything. But on the other side, in terms of being able to change our business, we do have training and regular training on infectious disease control. So all of our caregivers have received infectious disease control training and protocols. We are actually this month rolling out a regular COVID testing protocol for our caregivers. So they will be, in conjunction with the CDC recommendations, is to have regular testing in place so that folks that are coming into homes are somebody that you can trust. Unfortunately, though, with testing, it's often after the fact. So it doesn't prevent all infections. It just minimizes the spread, as the guest earlier was discussing. But it still will help contact tracing and allow us to make sure that we minimize future infections. Mm-hmm.
Other
Did
questions?
I cover the rest of the questions?
Yes, thank you.
Okay, great.
Dave, tell us, because of course with every service there comes a cost. Tell us how folks handle the expense associated with staying at home. And I guess we probably could presume that staying home is probably less expensive than ending up in a full-time assisted living facility, but there's definitely some costs associated, whether it be through the audit or modifications to the home, or to having help coming in on a frequent basis. So tell us about how that is paid for, insurance opportunities, et cetera, for the expenses associated with it.
Yep. So all of the home modification costs that we discussed earlier, just to kind of prep the home for living a little bit more safely at home, those are all one-time costs. And typically they're paid for out of pocket, but there can be some support through Medicare depending on the certain situation. Okay. Our services are private duty in a sense, so they're basically paying privately for the support. However, we do have certain programs. One of them is a veterans program that uses the clients or veterans aid and attendance benefit. So if they need extra support to stay where they are at home through their aid and attendance benefit, we can get 12 to 15 hours of support a week. Okay. Additionally, we work with many insurance, long-term care insurance carriers. So this is a separate insurance, not part of your health insurance. It's a separate insurance that some folks have, whether it was through their employer or they purchased it on their own. But long-term care insurance is a great tool to help pay for care. Sometimes there's a deductible period that you have to work through, but then after that, then the care is paid for by the insurance company after that.
Great, thank you. Angela, are you aware of other programs, whether they be local Carlisle programs or state programs for people who need financial assistance when it comes to staying in their homes?
I don't know of any particular for that, other than there are home modification loans that you can get to deal with widening doorways or making showers safer or replacing a tub with a shower. There are definitely support through them in terms of paying for long-term care. I'm not aware of any right now. Joan, are you?
Well, outside of personal care assistance, which is more of, a disability related thing that Mass Health would pay for. No,
Right.
For people that are not extremely low income, I think long-term care insurance is a way that some people have gone in the past, but no, I don't know of any sort of state subsidized programs. But I was curious, like what would you say is the average number of hours a week that you're seeing when you get a new client, a new person coming for the first time? How many hours a week would somebody expect when they're first starting out to get assistance?
It can vary significantly, Joan. It can start on the low end, 8 to 12 hours a week, a few days a week, up to, we do cover folks, around the clock care, every day or every day during the day. If there's just support, they need during the day. If at night, they're fine. Other clients, we come in just at night, just to help provide that break, probably for the loved one who needs some sleep. Mm-hmm.
Great. Any other questions for Dave? Maybe in a wrap up, Dave. What's the most important piece of advice you could give folks who are grappling with these staying at home issues and the potential of looking at other facilities for the seniors and their families?
My number one, or if I could have like a couple, maybe a couple, advice is be prepared for a trip to the hospital. I think that is very important to improving the outcome when you do get to the hospital, as it can be a smoother transition in, bring a list of meds, emergency contacts, even some leisure activities. Also, though, I would definitely suggest and recommend that folks stay connected and have an open dialogue with their healthcare provider, making sure that someone is aware and up to date on your situation, how things are going. They can often help recommend extra support or other types of programs, as we were just discussing, that are available. Last item is do get help when you're discharging. So going in or out of a hospital is a critical period to your health and your aging in place plan. So get some help from a loved one or whoever to make sure that transition home is smooth, and you avoid the 1 in 5. I'm just leaving with a statistic here: 1 in 5 Medicare patients go back to the hospital within 30 days. So that's some of the things in my mind in writing the book, is if we can stop that cycle and not have folks go back into the hospital, folks are going to have much likelier chance to live happier and healthier at home.
Doug, one more thing. If people are veterans and they are low income, then we can put them in touch with our new veterans agent, Gina Rada, and they may qualify for aid and attendance. So it depends on their income and their veteran status. But definitely, if somebody's a veteran, they should check that out.
Great. And I believe, Dave, you had some information on where, if people were interested in either your firm or your book, some contact information on that. And I know Angela is a wealth of resources, in addition to your firm, of companies and services that are available to the seniors in our community.
Definitely reach out to the Council on Aging. They're a great resource. So thanks again to them for hosting me today. But here's some contact information on the screen if you're looking for information about the book or about Assisting Hands. So our phone number and web pages if you have any questions.
Great.
Thank you so much, Doug.
Dave, thank you very much for being with us today. We really appreciate all of that very valuable information. I'm sure we could probably go on for hours on this, but we do have to move along. But we
No
appreciate
problem.
you taking the time and wish you the best. And hopefully the services you provide are helpful to both people in our community and the surrounding communities. And like I said, for me personally, this is all very helpful information as I grapple with these issues within my immediate family. So thank you for being here.
Thank you. You're welcome.
Thanks, Dave.
All right. At this point, we'll turn things over to Angela and Joan, who I'm sure have a lot of announcements about the activities and goings on at the Carlisle Council on Aging. So with that, take it away.
Okay, thank you very much. And thank you again for a very informative presentation. So I had talked a little bit in my introductory remarks about the kinds of assistance that we can provide, and that kind of dovetails into what the Friends of the Carlisle Council on Aging do for the community. The Friends are running their annual appeal, and most of the funds that they raise go directly to support people in need in the community, whether it's for, drive-throughs, that we've been doing during COVID, whether it's for activities that, are outside of our regular budget, whether it's direct assistance for people that need, fuel, food, emergency assistance. The Friends do a lot of really important work for the community. So I just wanted to highlight the fact that a lot of the support that we provide isn't necessarily public assistance, although we can help people apply for that, but it's community-based assistance, and the Friends is one of the ways that we access that community assistance. Also wanted to just mention transportation. We're currently providing rides to the town hall for anybody that needs to vote and wants a ride during early voting hours and on election day. So just give us a call. Transportation line 978-371-6690. And we provide services to all seniors and adults with disabilities in Carlisle. We also have the Carlisle Neighbor Response Team for seniors in need of groceries, pharmacy items, library books, or other essentials. And if you don't have anyone else to help you with these services, you can call the Carlisle Neighbor Response Team and they will help you out. Their number is 978-254-0508. Angela.
Hi. So we have some programs coming up, although most of our programs have been online. We hope that seniors will join us more with Zoom, and Chuck's been very, very helpful getting some of our seniors online with Zoom, and Bob Supnick's been helpful in terms of people who have had computer issues that prevented them from getting online. So if you're out there and you're know somebody that isn't able to use Zoom or do any of our programs, please give us a call at the COA and we'll put you in touch with one of our wonderful volunteers. But in terms of programming, we have several exciting things coming up. We have a brush lettering workshop for 4 days in November and December. It is on Zoom and you will pick up a kit, and it is a free class thanks to the Friends, and you can learn how to do lovely brush lettering, and that will be hosted by Miriam Florimond. And now we have on November 9th, and this is funded by the Carlisle Cultural Council, a ventriloquist. I know I remember seeing Lamb Chop as a kid, and Kevin Driscoll will be doing the show for us. And I have heard really good things about Kevin. And so I'm looking forward to the program. And so everyone in Carlisle or Concord or anyone that could see Channel 8 is welcome, or call us to participate in the Zoom. It will be later recorded and by Chuck and shared. So it will be at 3:45 to 4:30 so that families with kids can be home and watch it on Zoom. All you have to do is call the COA and we'll send you the Zoom link. We also have another grab and go that Joan mentioned, and it's going to be with a side of music. Kenny Seltzer from Village Court is going to be playing his guitar, and Open Table, which is one of our food pantries and in the area, is going to be providing the food, and they currently have chefs preparing this food. So we think it is going to be baked chicken, mashed potatoes, and green beans, and a beverage and a small salad, as well as dessert. And it's all free for the first 50 people that sign up. So if you feel like you could really use a good meal on November 16th, you can come by after you call and register with the COA, and you can get one of those meals. If you have dietary needs, such as you're gluten-free or you can't have dairy or you're a vegetarian, they will have options for those. So this will go fast. The last drive-through, I think we had almost 80 people. So if you want to do it, please let us know as soon as possible. Back to you, Joan.
Okay, so other virtual happenings that are going on, and these will all be covered in our newsletter, which is coming out probably beginning of November. We have Reading Poetry Anew on November 3rd and December 1st at 10:30. And it's an informal course led by one of our seniors, Mary Zoll, which will include poetry readings, reactions, discussions, and maybe some intellectual understanding of the poems. And to join this, you email Martha Feeney Patton at the Gleason Library or call at 978-369-4898. And then, we used to have coffees and different breakfasts and things where seniors could gather in person. And now we have virtual senior moments and digital coffee and conversation, 2 opportunities, and you're free to join both if you want, to just chat with other seniors. There's a facilitator and, different topics come up and people kind of form a little community on Zoom. So digital coffee and conversation is November 3rd and 24th and December 1st and 15th at 10:30, and virtual senior moments November 16th and 30th and December 14th and 28th at 9:30. And you can contact the COA to join and get the links and to be part of those opportunities. Angela.
Well, maybe we should go to Nancy and let her tell us what the Friends of the COA are doing.
Well, thank you, Angela. Of course, in an ordinary year, we would now be very busy with all kinds of interesting cultural programming for seniors. And the good news is we still are, and you can enjoy it from the comfort of your own home because our cultural programming has gone online. We have the recent presentations from Dr. Giannetti on immigration and Gary Highlander on the Cold War, both of which you can find here on the Minuteman Media Network public area under the Concord Carlisle COA section. We will also have music programs on classical music inspired by jazz and American music of the 20th century. Both of those are available via the library on Zoom. Starting today, October 21st is the first one, and the second one is available October 28th. And after that, the links will be available on the Gleason Library website under those dates to view whenever you'd like, anytime over the next 6 months. And the library will also make a DVD for viewing if that's easier for anybody than pulling it up by Zoom or on their computer. And lastly, as Joan mentioned, our fall campaign, fundraising campaign is underway. So you should see the flyer, which not only, of course, appeals for a donation, but also outlines in a lot of detail some of the things that the Friends of the Carlisle Council on Aging provide for the community. So the flyer is really well worth seeing just if you are not completely up to speed on what the Friends group does. And then you can also donate and get information at our website, which is on the carlisle.org site at FOCCOA for Friends of the Carlisle Council on Aging.
Thank you, Nancy.
Sure.
Joan, do you want to pick it up?
Sure. Okay, I'm going to talk about a few of the things that we have creatively managed to continue doing. For example, the haircuts on the go, which are extremely popular. The next, well, we have one coming up this week, but in addition to that, we have Monday, December 7th at the fire station. And if you would like to register, just give us a call, 371-2895. We have the 2 stylists and it's very safe and sanitized and people wear masks and it's been a very popular activity for people. And we also have our podiatry clinic November 2nd and 9th by appointment. So it's at Dr. Gregorian's office in Bedford, but it is subsidized thanks to the Friends of the Carlisle Council on Aging. So if you would like an appointment, give us a call and we can put you in the schedule. We do that every other month. So we'll have some in November and then again on January 4th and January 9th. And our exercise classes are still continuing through November 20th. And then they will be moving to Zoom. But for now, we have classes at the fire station 4 days a week. So if you're interested in signing up or learning more about that, just give us a call and we could add you to the list. Angela?
Thank you. So we also are still doing our KISS knitting. And matter of fact, the people from FRS and some of the members of the knitting group will be bringing in everything that has been made, either a scarf or a hat for Cathedral on the Common, and they will be doing that very shortly. So if you are at home and you have time to knit a scarf or a hat and you see this, the deadline is October 30th at 1 p.m. You can bring it into Town Hall. There is a box under a table on the way into the clock room, right across from the COA door. And we are so, so excited. We have already gotten over 200 scarves or hats. And so we're hoping that more of you might see this and think, well, I have the time to make one more hat. And I'm sure this winter they're going to be needed more than ever, because we expect that there's going to be more people homeless, unfortunately, because of COVID. So whatever you can do, that would be great. And if you want to join us, just call the COA and we'll give you the link to the Zoom meeting. We meet on the third Thursday of every month at 7:30. And we get to see people from Maine and all over the place, because our fearless leader for KISS, Linda Myers Tierney, has moved to Maine, but we're continuing on, and she's going to Common Cathedral with the scarves and hats. So thank you for that. And then I just want to remind people it's Medicare open enrollment. If you are 65 or older, you can join or change your Medicare between October 15th and December 7th. So now is the time to take a look at what your benefits are. Do they match your current medical needs? Is there a better prescription plan for you? Are you in Medigap and you find that you really can't afford it? Maybe an Advantage plan is better, or maybe your medical issues have increased and you want to go to a Medigap plan. So we do have a Shine counselor, Clyde Kessel, who's available for individual meeting, as well as we will be doing a Zoom open enrollment talk. And we have an exciting project that Nancy Showett-West has been doing with us called a mini memoir project. And I was thinking, Doug, maybe this is something your parents might like to do. So it's all about trying to have people touch base with their families and friends and talk about what piece of their life, or is there a summary of their life that they would like to provide in writing and leave for their family and friends. And so Nancy's been working on this, and we got originally a grant from Chinook, and we did 15 of these, and every single person that did it really enjoyed it. And because of the friends, we're going to do another 10. So I think we have 3 people on the second 10 so far. So we have 7 openings. So if people might like to do it, if you've had an interesting life, or your children may not know what you did before you became their grandparents, please feel free to give us a call at the COA and we'll put you in touch with Nancy. And it's a very easy process. She'll tell you what to think about, what to ask about, and then she'll interview you for about an hour, and then magically you'll get this wonderful write-up. So I'm excited about that. Joe.
I'm going to take you up on that one, Angela and Nancy. I think it would be wonderful to have that done. I know for my family, and I'm sure for many other families. So thank you for making that offer.
Well, I will get you the information for your parents.
Thank you.
Excellent.
Sounds great.
I think we've covered most of what's, coming up in our newsletter. I did want to mention the distant Reiki opportunity that we have. I just recently heard from a senior talking about how it has been life-changing for her and that she highly recommends it to other people. So if you don't know about Reiki and you want to know more about it, you can give us a call and we'll tell you about it and put you in touch with the sensei. I recommend it based on what I've heard from other people, and it's totally free. So you can try it and see, how it works for you.
Terrific. And we do have one more Zoom program that's coming in January called Myths, Mysteries, and Spying. It's all about Henry Quinlan, who's the owner and publisher of Omni Publishing Company, and his 30 years involvement with the former Soviet Union and Russia. So that should be very interesting. I've heard people that have heard him do this talk and they've really enjoyed it. Just as a reminder, Dave was mentioning have the important information that you need about your medications, your emergency contacts, who your doctors are. We have a document called a File of Life that you can fill out and put on your fridge, and that's important for first responders. If you don't have one, please call the COA. You can either come by and pick it up. We're open 10 to 2 Monday through Thursday, or 10 to 1 on Friday, or we'll mail it to you if you don't want to go out of the house. We also have something called a Yellow Dot program. If you happen to have a medical issue, maybe you're diabetic, maybe you're on a certain kind of medication that's critical, there is a form that you fill out and you keep it in your car, and there's a sticker you put on your car rear window, and that will tell emergency responders that your emergency information is in your glove box. So that again is free to you because of the Friends of the Council on Aging, and we're just thrilled that you can just give us a call and we'll send it to you, or you can come by and pick them up. So those are just a few things that we're have available for you. But always, if you have any needs or you can think of something that you need help with, please call the COA. If we can't help you, we'll try to find the right resource for you. And as Joan said, our number is 978-371-2895. And back to you, Doug. I think we're getting close on time.
Yes, yes, we are. So it amazes me during what we might call normal times, the amount of activities and opportunities that the Council on Aging offers for Carlisle seniors and residents. And I'm even more amazed at the opportunities that exist during these times. So thank you, Joan. Thank you, Angela. Thank you to all of your team and staff for everything you do. Nancy, thank you to the Friends as well. That's a key component of the senior world in Carlisle. I thought before we close, since it's coming up in just a couple of weeks, Joan, you mentioned earlier about help getting to the polls for the election. Could you just remind everybody if they need a ride or what have you, what's the step?
Well, you can call us directly at the COA, or you can call our transportation line, which is 371-6690, and we will get you a ride, to and from Town Hall, any of the weekdays when we have early voting, and obviously on election day. So we don't want anybody to not be able to vote because of transportation. So if that's your barrier, give us a call and we will be able to, assist you.
Great.
And vote.
Yes.
Important to vote, yes.
So as we close, I just want to thank all of you again personally. Angela, thank you so much. Joan, thank you very much. Nancy, thank you very much for being with us. Dave, thank you as our featured guest today. We really appreciate the services that you have to offer and the information that you've given us today. And I must mention our IT extraordinaire, Chuck Bagnaschi, behind the scenes, doing the great work and hopefully making us all look good, because some of us need help in that area. So thank you, Chuck, as always, for your efforts on our behalf. So with that, we will close the October 21st, 2020 edition of the Carlisle Community Forum. Again, wishing everyone well and safety during these challenging times. And we hope to see everyone in person as soon as it's possible. So thank you for joining us today.
And happy Halloween.
Happy Halloween.
Thank you.
Thanks, everyone. Thanks,
Thank
Doug,
you.
for overseeing it.
Thank you.
Bye.
Bye.
Thank you.